22 now. Good morning if you've just joined us. Every day on Breakfast we've been speaking to a GP about the coronavirus pandemic. Today we're joined by Dr Jamie Parker, who is in Nottingham for us this morning. Jamie, good morning. Thanks very much for getting up early to speak to us. What's been the big issue for you in your surgery this week?
Sorry, could you repeat the question there, Roger? Sorry.
Yeah, sure. Just wondering what the big issue that people have been speaking to you about in your surgery has been this week.
Yeah, we've been really trying to explain to people that they shouldn't be staying at home and not seeking help when they should be. We're worried about people not calling, for example, with serious health conditions. We sent out a text to all our patients to reassure them that we are there for them. If they're worried that they're unwell, they should be seeking medical help. You know, whether that's 999 if they're having symptoms of a heart attack or a stroke, or whether that's calling us if they're worried about symptoms, for example, of cancer. It's that reassurance that we are there for them and not just for those patients who are worried about coronavirus. And
how have you found the remote appointments have worked? Often doctors, I had an appointment with my own GP when we did a FaceTime effectively. How have they been working?
To be honest, remarkably well, actually. The speed with which we've been able to adapt has been quite remarkable, actually. From mainly face-to-face contact, it's now sort of a handful of face-to-face contacts in a day. The actual technology, being able to call, being able to use the video calls, or allowing patients to actually text us back, for example, a photo, has been amazing. I think it is a challenge clinically. It is really exhausting doing remote calls, and personally I am missing the regular face-to-face contact. There's certainly amounts of in terms of isolation fatigue that I'm feeling, and I'm definitely missing that face-to-face contact, but needs must.
Face-to-face contact is an interesting point, because that now, as we go into a 7th week of lockdown, many people who are having to self-isolate are finding that that's something they're missing. Mental health is something that is going to become an increasing problem, isn't it?
Yeah, I think so. And I think we're seeing that. We're seeing an increasing number of calls about mental health, quite right. It's really difficult times, generally very uncertain times. There's a lot of anxiety. But if you add to that sort of the isolation, loneliness, it can be really difficult.
What's the advice to people if they are feeling particularly lonely after so much time on their own?
Well, I think that there is always help. There are a lot of volunteers. You know, you don't have to worry that you've got a mental health issue. If it's just someone you need to speak to, we can arrange. There are lots of volunteers that can just call and touch base with you on a daily basis. But I think what it relies on you is actually, seeking the help. I know those patients who are in the shielding group, those are the ones who've got a letter from the government, and the highest risk group will have got a letter that there'll be a number on there for them to call, or they can register. They'll be having daily contact anyway. But it really, asks for help if you're struggling.
And it's interesting, you mentioned the group who are shielding. There are different people who are categorised in different ways and at different risk. I noticed the Deputy Chief Medical Officer talked about the advice becoming more stratified. Can you just explain what that means and what factors are likely to be taken into account when that advice is given?
Right, so I'm not so party to those discussions, obviously, but as far as I understand it at the moment, there are different groups of clinical risk, and there is some confusion, I think, between the clinically vulnerable group and the shielding group. The shielding group are those in the highest risk, and they were the patients who would have received a letter either from the NHS or their GP explaining to them that they should be self-isolating for 12 weeks, and there is some very sort of strict advice on that. That is very different to the clinically vulnerable group, who are slightly lower risk, who have been advised to strictly follow the social distancing advice that the government have given. I think there has been some confusion around there from that point of view.
Oh, Jamie, I know you've had a very unique way of spreading the message as well. We're just going to have a listen to some of your vocal excellence. Have a listen to this.
'Cause every time you stay at home, you're saving lives that aren't your own. You're keeping safe and helping others too. Please think of what the world could be. Stay at home, your family will thank you when it's done. Please stay at home. COVID at bay. We are really all relying on you. Great Britain, the NHS is here for you. Please stay at home. Please stay at home. Behind you will save lives.
Well, that's cheered us all up first thing on a Sunday morning. I have to say, you even managed to get a bit of Frozen worked into that, which was fantastic.